So this talk is about the 6 keys to your success in global health internships. And you are all participating in the International Exchange Program for Minority Students. You are the 12th or 13th group that has gone through this program. So I think I have a lot to say about this topic because I've been at it for about more than 20 years. And the reason why I feel I'm confident in my expertise in this area and to tell you about these key points that I think are gonna make you successful in it is that at first, in my first grant in global health was I think 1995 or something like that. Sorry, the first time that I received one of these grants, my role was to train scientists in other countries, especially I was focused in Latin America, particularly in Mexico, Brazil, and Chile, to train scientists, mid-career level people who already had some skills but needed more training in research to conduct research projects in their home country in environmental and occupational health. So the format of it was that they applied. Sometimes I invited people to apply. If I met somebody who had potential at a conference, at an international meeting, I would invite them to apply. I would give them you would be great for this. And then, or sometimes they would be referred to us by a partner in an institution, like the Institute of Public Health in Cuernavaca, Mexico is one of the great examples that referred a lot of people to me. And so through that program, they would submit to me a proposal, we would review it, and we would fund it, and they would come for guidance, but for very short, like 1 month stays in between. Like they would come and draft a paper or do data analysis with one of our faculty members or with me. And that avoided a lot of the brain drain that happens with a lot of training programs where they bring people here and they never come back. So I funded the projects over there, the projects that the research projects were done there. And the product has been that there were 52 international fellows that I supported through that program. And many of them are now the mentors that are gonna be hosting you in your research projects now. So it's kind of been full circle kind of idea where you can see that some of the pictures of me training some of the students that have gone through these programs, both the international and the US based people. So as a result of all that, we have sustained collaborations, research collaborations in 15 research institutions in 9 countries over 20 years. Most of them over 20 years, some a little bit less, like India is just starting, but basically, Thailand is just starting and India is gonna be phased in a couple of years. So, as you can see, I think that gives me a lot to say about what can make international research experiences successful. And I hope that I can convince you of those things. So I wanted to tell you about the 6 keys to successful opportunities in global health research. And the first one is to identify your strengths. And I mean to identify all of your strengths. And I told you yesterday about some of the story of how of my training, my early training, my doctoral training in, I was a research basic scientist on the blood-brain barrier. And so I was trained at the Albert Einstein College of Medicine, which is just as it sounds, like an ultra basic science oriented, really, high-tech kind of work at the time, especially. I mean, this is a long time ago, so notice the big monitors, but still, yes, that's me. Doing blood-brain barrier work at the time, and so as a student, and so I was being trained with the highest technology at the time, and in cell biology, neurobiology, and these are the skills that I thought I had when I graduated from my doctorate degree. But soon after I graduated, I was working on the blood-brain barrier, like I said, that has to do with multiple sclerosis. And at the time that I graduated, around early 1990s, let's just say, there have been in the news and around the neurobiology circles this news about this optic neuropathy episode in Cuba. It was like it seemed like a epidemic. About 50,000 people had been affected. It looked like multiple sclerosis in that it started with the optic neuropathy. It had a peripheral neuropathy type of a paralysis sometimes. Many people were being affected. Nobody knew what was it. I mean, some people thought it was a virus. There was a lot of speculation. And there was a team of neurologists that were starting to get together to try to, at the time, the embargo, it was very hard to travel to Cuba. So we were trying to put together a team of people who could go there and try to investigate. And since I spoke Spanish, even though I was very junior, I joined that group and happened to be there at that time for some other reasons as well. So as part of that effort, I learned something very interesting that I think pertains to this idea of bringing all of your strengths to the global health experience. Because I thought I was going there as a neuropathologist, that's my thing. But in fact, my experience growing up in Puerto Rico helped me to understand this episode more than the training that I received at Einstein. Because it turned out that when I was walking around and talking to people, I found out about the nutritional deficiency that people were experiencing due to the embargo. And at that time, the fall of the USSR had caused many shortages of food. So as you can see here, there is a line of people waiting for their rations, and this is the record of the rations that they were receiving. So there was a deficiency of vitamin B complex vitamins. And that together with, I was talking to this pharmacist, and what he was offering was herbal remedies in the pharmacy, and also talking to people who were distilling moonshine. And I just happened to know from my grandfather's teachings that pitorro, if you don't distill it properly, it can be contaminated with methanol. So the combination, you could only get this neuropathy if you had a combination of the nutritional deficiency and methanol. And this was replicated later in animals when the other doctors came and followed up on this event, and they had a very simple remedy. So that taught me that, like I was saying to you yesterday, it's not just my training, my formal training, your formal training, your excellent formal training, because you guys are very blessed in what you have been given as or what the education that you have bought, to have received some of the top quality education that you can buy. But that's not the only thing that you have. You have your other experiences that you can bring to bear to your experience in global health. So that those earlier pictures are from a paper that I published on that from that visit to Cuba, and this is the cover of the paper that was published in Environmental Health Perspectives, which is the top journal in environmental medicine. So just to tell you that bring all of your strengths to your global health experience. Your academic training is very important. That's part of the reason why you're here. But each one of you have some unique other experiences that make the academic and the personal experiences come together in your global health research training. Okay? So key number 2 to your success in global health is No superhero. Be humble. And this is, I cannot emphasize this one enough. This is a drawing that my daughter gave me. So I sort of use it. But one of the biggest mistakes that people, especially people from first world countries, go to third world countries to save the day. You know, here I come to save the day, right? Isn't that like a Mighty Mouse or one of those things? That kind of attitude is really a major problem, I believe, and hindrance to your success in global health. And I see it in so many examples. I don't really want to give you examples. We can talk about some later, but this is, I think, one of the problems in some of the global health approaches that some programs have. We come with all the knowledge and we're going to go there to save the people. And what happens is that it doesn't happen, right? So you are, keeping it in perspective that you are very well trained in your areas, and like I said, you have many strengths. At the same time, you must be humble in what you don't know. And this experience, going into this experience with the attitude of saving the world, is not going to help you or the situation. So expect to work very hard instead of expecting to go there and saving people or saving anything, really. Expect to work very hard and be humble, because if you're not humble, you're not going to be open to learning. And your first goal in this experience, in the international experience that you will have, is to learn, because those are experiences that are going to help you along in your career, okay? The third key to your success in global health is train with a local expert. And to this group, I don't really have to tell you, because I've chosen a local expert for you. But in so many other training programs, they just send people to different places and not necessarily with a mentor that is an expert. And I know some other programs that send students to work in a group or in a NGO or something, as a group or or in a project that a U.S. mentor has. But there's nothing like being trained by a local expert. And I was thinking about a way, an example in which I was trained by a local expert. And I can give you the example of my experience with Dr. Frederico Perez, who some of you are going to work with in Brazil. I don't know sometimes who trained who. He was my postdoc, but actually I think I learned a lot more than he learned from me. When we were working in this project in Brazil about pesticide exposure, one of the things that was apparent is that many women and children were being exposed to pesticides in this community. And when you would ask people if, the farmers, for example, do you wear the respirators? They would say yes. Does your children or your wife work in the field? They would say no. But in fact, when you recruit local people to really observe and talk to the workers and to the people exposed about how they really are using pesticides, you would notice, for example, that maybe the child was not working in the field, but maybe they go to talk to their dad. I don't know, maybe he was asking for some money to go buy something, or just talking to him about after school or something like that. But he's talking to his dad at the same time as the dad was spraying. And if you would have asked them, does your child work in the field? They would have said no, he wasn't working. right? Do you use the respirators? Well, sometimes they use it like a bufanda, like a necktie or something, some fashion statement, I guess, but not correctly. Okay. In fact, he's standing barefoot in a pool of pesticide. So, unless you recruit community-based participatory research in that kind of format, you would not be able to see any of this and to explain the epidemic of pesticide exposure that we were seeing there. So one of the things that I learned from Federico, it wasn't only about recruiting people to find about the problem, but also recruiting people from the community about the solution. So one of the things that I learned from him was people in this community are fanáticas de fotonovelas. And Nancy, I'm sure you know what those are. They're like kind of like comics, but real, like with real people, and they tend to be like romantic stuff. Let's just say romantic. And people really love those there. So one of the things that we did was to recruit the people from the community to act as actors in the fotonovela and tell the story of how to avoid pesticide exposure. And those were very popular. And we also did something similar with a comic book for the children. So again, when you do, at the time when I was working with him on this, the term community-based participatory research was new really to me and in the U.S. And learning from Federico as a local expert opened my eyes to this kind of work. When I came back from this experience, I'd actually used some of these techniques in the work that we were doing in asthma in minority communities in New York. And, I really owe all that to what I learned from Federico in this project in Brazil. So the fourth key to your success in global health is emphasize your reason. And this one is really cool. And I'll give you the example of my dear friend Rebecca Hart, who's a director at the Centers for Disease Control. And she had been many, many years ago a Peace Corps volunteer. Paulina, you were. And her assignment was in Costa Rica. Her planned project in Costa Rica was to plant a vegetable garden to supplement the diets of people in this community. That was her planned project. And so she was going to work with the women in the village to plant this garden. One day, she noticed, first of all, that they weren't so into it. They were like, oh, at their feet. It's like, And she was getting frustrated because here she is, a Peace Corps volunteer, spending her time there, not making any money, and having to push people to get to do this work. One day, one of the women, got brave and stood up and said to her, we really don't like working outside in the sun. It's really hot, And so instead of Rebecca, which I've seen in other Peace Corps volunteers and other people, being kind of personally offended by that, saying, oh, well, I'm helping you for your community and this is what you say to me. Instead of that, she said, okay, let me think about something else that we can do. So at the time she had taken before she left, she had taken some painting classes. And I don't know if she's that good, but that's No, nothing to be ashamed of. But she had learned some techniques about painting, and so they had a community center at the place. And so, why don't we get together and paint maybe until at least the sun comes down, and then we can do the project. Turned out that the women in this community were very talented, and they started to paint their dreams, the things they care about, their folklore, the things that everyday life. And because Rebecca is very smart, and she's my friend, and I love her, she had with a collaborator help the women after many international gallery exhibits later, publish a book for children using the artwork that they created in this place. Because of that, just last month, actually in April, they created their group Corazones Valientes, and they had another exhibit. This is more than 20 years later, after Rebecca went as a Peace Corps volunteer. They had another exhibit in Atlanta at a gallery there. They still sell out their pieces, and their book still sells. My daughter has it. I was gonna bring it and show it to you. So I don't know how many girls in the community actually named Rebecca after her, because her legacy still lives. So what I'm saying to you with this example is this. Emphasize your reason, not your project. Why are you there in the first place? Okay? Is it to, get this project done? Or is it for another goal, a higher purpose, right? And so if your project needs to change to accommodate the local circumstances, the heat outside, the rains, that you couldn't go to the field to do something, what is your reason? Ask yourself that question. And then maybe you find a way, by collaborating with your local community, find something that actually reaches that goal even better than you thought. So I could not think of a better example than Rebecca's project. Okay. The fifth key to global health is network and partner. You guys is in such a unique position to be able to have a unique vantage point about global health. Because those of you who decide to continue in global health will actually have more than one experience in more than one place along the way. Maybe now you go to Costa Rica on this summer program, and then 2 years from now you apply for a Fulbright and you go to Bangladesh, and then you went to Albania, and then you go into Brazil and Chile, and you start to accumulate all these international experiences and this global health view that is very unique. Really, not even many of your mentors over there are going to have the experience that you will have over the years. Okay, that will give you a macro vantage point that you can maximize by networking and partnering. And let me show you an example of that. I have a collaborator, Dr. Joao Machado Torres. And like I told you, I have this program where I train researchers in Latin America. So that gives me that kind of vantage point of having people in Mexico and Chile and Brazil. And so Dr. Joao Machado Torres is an expert in how to measure different pollutants in different media. And so one of the things that we were doing is measuring persistent organic pollutants and how they bioaccumulate from the sediments in Amazon rivers to the fish, to the breast milk, and to the children. So we were able to show this kind of bioaccumulation loop. This resulted in several papers, and since I had collaborations in Chile, I knew about some people there who had access to one of the research centers in Antarctica. So putting those two together, my collaborator from Brazil and these people I knew from Chile resulted, because they have also issues with persistent organic pollutants in the ice. They were able, I was able to find some funds. All I had to do was pull these people together, and so they were able to track the same persistent organic pollutants in the ice, the eggs, the fish, and the birds of this area of Antarctica, applying the same kind of techniques that Joao did. Again, this also resulted in several research papers. So my role there was, again, like I tell you, network and partner. If you get to know somebody in the area of pesticides, now in Costa Rica, and then 3 years later you're working on pesticides in Puerto Rico, how about making that linkage? Okay, you'll be in a unique position to do that kind of work. And actually, this is the slide that I wanted to show you earlier about how learning from my partners in Brazil, Joao and Federico and all them, how those skills that I gained from them were really helpful for me to work on environmental justice projects here it was in Harlem, as well as in Ecuador, in a paper that I published about titled "The Global Push for Environmental Justice." This kind of experience will give you that kind of global health perspective. So you start to accumulate this, and don't let these international fellowships that you will be embarking on as you go along be just these separate seeds. What the power that you will have is trying to link them together, and they will become a bigger forest of new ideas that you didn't anticipate before, like your experience that you had in Albania. So how can you network that and to connect it to what you are going to be doing now might be a really good example of how the 1 + 1 doesn't necessarily equal 2. It can equal more, okay? So the sixth key and final key to your success is document lasting accountability. And this has to do with what I just told you before. And you may have noticed, I know that Wayne just noticed also how I gave you examples of some of the papers that resulted from these projects. And that was by design that I put those there, because I wanted to notice that even things that I have been working on for 20 years may now have the fruit of a published paper. Because those collaborations take time, things you start continuing collaboration with them, with the partners that you make. What I'm trying to explain is, don't let this international research experience become a distant memory. A lot of times what ends up happening is that you go for 3 months, you do this research project, you come back, you start medical school, you forget about it. You don't keep in touch with those people. By the time you think about it again, it's 2 years later, and you feel embarrassed to even email them because it's been so long. Put it in your calendar, make it a commitment that you're going to continue keeping that connection alive. because I guarantee you, especially because I know the mentors that you're going to be working with so well, these are such high-level experts that at some point in your life you might want a letter of recommendation. How many times have I had students that I haven't heard from 6 years send me an email, I need a letter of recommendation? And it's like, which one are you? Okay. And I haven't heard from them in a long time. Don't do that, okay? You want to, even if it's, even if you finish the project, which I doubt, most of you are going to, if you really want to get as much as possible from this experience, you will continue working in the project after you come back. How is the data coming? Are those cells, growing? Are there more data? Can I help you write that part? Okay, I'm drafting the outline. What do you think? And there's a process that will continue on, and I expect you to be able to do that. Okay? So don't just let it be something in the past that you did when you were young and went for that great summer in Brazil. Don't let it be a distant memory, because your benefit would be in the long-term process. And that's what has been for me. Otherwise, I wouldn't be director of these programs if I would have just dropped those people as I went along. Okay? So this is an example. This is Dr. Jaime Silva, who I worked with a long time ago, and then later on we have continued to collaborate. Through another student like you, we presented 2 years ago a poster in a conference in Sao Paulo, and I've known him for 18 years when we started working together. And of course, in the next few days, I will tell you more about specific instructions on how to write your research papers, how to collaborate with your mentors, and how to try to get those posters or papers published. I tell you that an amazing number of students from this program publish research papers in peer-reviewed publications and or also present in scientific conferences. So, to summarize, these are the 6 keys to successful opportunities in global health. I want to review them. And the first one was identify all of your strengths, your academic strengths and your personal strengths. How do these come together to make you an excellent person to have in a global health experience? No superhero. Work hard and be humble. Train with local experts. It doesn't matter how much you already know. There's somebody there in the local place, in the local situation, that knows much more than you. And so if you are humble, you'll be able to learn from them. Emphasize your reason. It's not your project. It's not about completing this particular project that you may have intended or envisioned when you went. It's about the reason why you're there and reaching that goal in the best way possible. Network and partner. You're going to be in a great vantage point situation to make those linkages between people. And the final one, document and lasting accountability. This is just the beginning of a relationship that you can have. It all depends on you. That will take a very long time to continue to develop and bear fruit. So it's going to be up to you to follow up on those, write the papers, write the posters, and continue in touch with your mentors so that you can get those fruitful outcomes. So maybe you notice that this, to help you remember these 6 key things about global health, they spell intend to be a Sherpa, intend Sherpa, right? And the reason that I wanted to help you with remembering these is that don't be like this guy. You know, I think anybody who has traveled anywhere probably has seen this guy, this kind of guy that goes on these international experiences for the great selfie opportunities that they're gonna send and they're gonna, post on Facebook or whatever. But really, the Sherpa or the local person is the one who is actually doing most of the work. I expect you all to work extremely hard and be more like the Sherpa, not like the guy, okay? Have the intentions beforehand of being the person that's going to be with your local collaborators and really lift the burden together. You're not going to go there either like a superhero or like an expert. You're going to go there to work together with each other. As you notice, there's going to be two of each of you going to these research sites, but also with your collaborators and your mentors. That's what I expect from you, okay? So thank you very much.